81. Which of the following is the most common neurological complication seen in systemic lupus erythematosus, SLE? A. Seizures. B. Stroke. C. Headaches. D. Peripheral neuropathy. Answer: seizures. Rationale: seizures are the most common neurological complication in SLE due to the involvement of the central nervous system. Stroke and peripheral neuropathy are less common, and headaches, while frequent, are not as specific to SLE. 82. What is the goal of treatment for lupus-associated thrombocytopenia in a patient with systemic lupus erythematosus, SLE? A. Increase platelet count. B. Improve renal function. C. Reduce fever. D. Control blood pressure. Answer: increase platelet count. Rationale: the primary goal in lupus-associated thrombocytopenia is to increase the platelet count. While other treatments may be indicated for other symptoms, thrombocytopenia specifically requires interventions aimed at platelet production or function. 83. Which of the following factors is most likely to trigger an exacerbation of systemic lupus erythematosus, SLE? A. Sun exposure. B. Increased physical activity. C. Stress management. D. Antibiotic use. Answer: sun exposure. Rationale: sun exposure is a well-known trigger for exacerbations of SLE, as UV light can worsen skin rashes and induce systemic flare-ups. Increased physical activity, stress management, and antibiotic use are not direct triggers of SLE flares. 84. Which laboratory test result is most indicative of active SLE with renal involvement? A. Low C3 and C4 complement levels. B. Positive rheumatoid factor, RF. C. Positive anti-CCP antibodies. D. Elevated hemoglobin levels. Answer: low C3 and C4 complement levels. Rationale: low complement levels, C3 and C4, are indicative of active SLE, particularly in cases with renal involvement. Rheumatoid factor and anti-CCP antibodies are more indicative of rheumatoid arthritis, and elevated hemoglobin levels are not typically associated with SLE activity. 85. Which of the following is a common side effect of hydroxychloroquine used in the treatment of systemic lupus erythematosus, SLE? A. Retinal toxicity. B. Weight gain. C. Hypertension. D. Hyperglycemia. Answer: retinal toxicity. Rationale: hydroxychloroquine can cause retinal toxicity, which can lead to vision impairment. While weight gain, hypertension, and hyperglycemia are common side effects of other medications, they are not typically associated with hydroxychloroquine. 86. A patient with systemic lupus erythematosus, SLE, is being started on cyclophosphamide for lupus nephritis. What is the most important monitoring parameter? A. Renal function. B. Liver enzymes. C. White blood cell count. D. Blood pressure. Answer: white blood cell count. Rationale: cyclophosphamide can cause bone marrow suppression, leading to a low white blood cell count. Monitoring renal function, liver enzymes, and blood pressure are also important but are not as directly impacted by cyclophosphamide. 87. What is the hallmark of systemic lupus erythematosus, SLE, on a skin biopsy? A. Lichenoid dermatitis. B. Discoid lesions. C. Malar rash. D. Vasculitis. Answer: malar rash. Rationale: the hallmark of SLE on a skin biopsy is the presence of a malar rash, often described as a butterfly-shaped rash over the cheeks and nose. Other skin findings like discoid lesions, vasculitis, or lichenoid dermatitis may be seen in SLE, but are not the hallmark. 88. Which of the following medications is commonly used in the treatment of systemic lupus erythematosus, SLE, for mild disease, but is avoided in active renal or central nervous system, CES, lupus? A. Methotrexate. B. Hydroxychloroquine. C. Azathioprine. D. Nonsteroidal anti-inflammatory drugs, NSAIDs. Answer: hydroxychloroquine. Rationale: hydroxychloroquine is commonly used for mild SLE, but it is avoided in cases of active renal or CNS lupus due to the risk of potential toxicity. Methotrexate, azathioprine, and NSAIDs may be used in various phases of the disease, but are not as specific to this context. 89. What is the most common cause of death in patients with systemic lupus erythematosus, SLE? A. Cardiovascular disease. B. Infection. C. Renal failure. D. Stroke. Answer: cardiovascular disease. Rationale: cardiovascular disease is the leading cause of death in patients with SLE, likely due to accelerated atherosclerosis associated with chronic inflammation. Infection, renal failure, and stroke are also causes of death, but occur less frequently than cardiovascular disease. 90. Which of the following is the best dietary recommendation for a patient with systemic lupus erythematosus, SLE, on corticosteroid therapy? A. Low sodium, low fat diet. B. High protein, low carbohydrate diet. C. High calcium, high vitamin D diet. D. Low calcium, low sodium diet. Answer: high calcium, high vitamin D diet. Rationale: patients on corticosteroid therapy are at increased risk for osteoporosis, so a diet high in calcium and vitamin D is recommended to support bone health. A low-sodium, low-fat diet may help manage cardiovascular risks, but high calcium and high vitamin D are more specific recommendations. 91. Which of the following conditions is most commonly associated with systemic lupus erythematosus, SLE? A. Rheumatoid arthritis. B. Sjogren's syndrome. C. Osteoarthritis. D. Multiple sclerosis. Answer: Sjogren's syndrome. Rationale: Sjogren's syndrome is commonly associated with SLE and shares similar autoimmune mechanisms. Rheumatoid arthritis, osteoarthritis, and multiple sclerosis are autoimmune conditions, but are not as commonly associated with SLE. 92. Which of the following laboratory tests is used to assess disease activity in systemic lupus erythematosus, SLE? A. Anti-Smith antibodies. B. Serum complement levels. C. Rheumatoid factor, RF. D. C-reactive protein, CRP. Answer: serum complement levels. Rationale: low serum complement levels, C3 and C4, are indicative of active disease in SLE and are often monitored to assess disease activity. Anti-Smith antibodies and RF are not typically used to assess disease activity, and CRP is less specific for lupus. 93. A patient with systemic lupus erythematosus, SLE, presents with chest pain, pleuritic breathing, and shortness of breath. Which of the following is the most likely diagnosis? A. Pulmonary embolism. B. Lupus pleuritis. C. Acute myocardial infarction. D. Pulmonary hypertension. Answer: lupus pleuritis. Rationale: lupus pleuritis, an inflammation of the pleura due to SLE, is the most likely diagnosis given the patient's chest pain, pleuritic breathing, and shortness of breath. Pulmonary embolism, myocardial infarction, and pulmonary hypertension are less likely given the context. 94. Which of the following is the primary mechanism behind the renal damage in lupus nephritis in systemic lupus erythematosus, SLE? A. Immune complex deposition. B. Direct viral invasion. C. Hypertension-induced glomerular injury. D. Hyperglycemia. Answer: immune complex deposition. Rationale: immune complex deposition in the glomeruli is the primary mechanism of renal damage in lupus nephritis. Direct viral invasion, hypertension-induced glomerular injury, and hyperglycemia are not the primary causes of renal damage in this context. 95. Which of the following is the most appropriate method for diagnosing lupus nephritis in a patient with systemic lupus erythematosus, SLE? A. Urinalysis and kidney biopsy. B. Blood pressure measurement. C. Chest X-ray. D. CT scan of the abdomen. Answer: urinalysis and kidney biopsy. Rationale: urinalysis and kidney biopsy are the most appropriate methods for diagnosing lupus nephritis. Blood pressure measurement, chest X-ray, and CT scan are not diagnostic tools for lupus nephritis. 96. Which of the following is the most appropriate first-line therapy for managing mild to moderate systemic lupus erythematosus, SLE? A. Methotrexate. B. Hydroxychloroquine. C. Cyclophosphamide. D. Rituximab. Answer: hydroxychloroquine. Rationale: hydroxychloroquine is the first-line therapy for managing mild to moderate SLE due to its effectiveness in controlling disease activity and preventing flares. Methotrexate and cyclophosphamide are used in more severe cases, and rituximab is used in refractory cases. 97. Which of the following antibodies is most specific for diagnosing systemic lupus erythematosus, SLE? A. Anti-Smith antibody. B. Anti-Rho antibody. C. Anti-dsDNA antibody. D. Antinuclear antibody, ANA. Answer: Anti-Smith antibody. Rationale: Anti-Smith antibodies are highly specific for SLE, while ANA is sensitive but not specific, and anti-dsDNA antibodies are associated with active disease but are not as specific. Anti-Rho is seen in conditions like Sjogren syndrome. 98. A patient with systemic lupus erythematosus, SLE, presents with fatigue, a malar rash, and arthralgia. What is the most appropriate next step in management? A. Initiate hydroxychloroquine. B. Start corticosteroids. C. Begin cyclophosphamide. D. Perform a kidney biopsy. Answer: Initiate hydroxychloroquine. Rationale: in a patient with mild symptoms of SLE, such as fatigue, malar rash, and arthralgia, hydroxychloroquine is the first-line treatment. Corticosteroids may be considered for more severe symptoms, but hydroxychloroquine should be the first step. Kidney biopsy is not indicated in this case. 99. Which of the following is a common complication of systemic lupus erythematosus, SLE, that affects the cardiovascular system? A. Endocarditis. B. Pericarditis. C. Myocardial infarction. D. Heart failure. Answer: Pericarditis. Rationale: pericarditis is a common cardiovascular complication in SLE due to inflammation of the pericardium. Endocarditis, myocardial infarction, and heart failure are not as commonly associated with SLE. 100. A patient with systemic lupus erythematosus, SLE, presents with photosensitivity and a butterfly-shaped rash on their face. Which of the following is the most likely diagnosis? A. Contact dermatitis. B. Psoriasis. C. Systemic lupus erythematosus, SLE. D. Rosacea. Answer: Systemic lupus erythematosus, SLE. Rationale: a butterfly-shaped rash with photosensitivity is characteristic of SLE. Contact dermatitis and psoriasis do not present with this specific rash, and rosacea typically affects the nose and cheeks, but not in a butterfly pattern. 101. Which of the following is a key feature of lupus nephritis in a patient with systemic lupus erythematosus, SLE? A. Proteinuria. B. Hyperkalemia. C. Hemoptysis. D. Erythema nodosum. Answer: proteinuria. Rationale: proteinuria is a key feature of lupus nephritis, indicating kidney involvement in SLE. Hyperkalemia, hemoptysis, and erythema nodosum are not characteristic of lupus nephritis. 102. Which of the following factors is most likely to contribute to renal involvement in systemic lupus erythematosus, SLE? A. Hyperthyroidism. B. Antibodies to double-stranded DNA, anti-dsDNA. C. High-fat diet. D. Alcohol consumption. Answer: antibodies to double-stranded DNA, anti-dsDNA. Rationale: anti-dsDNA antibodies are strongly associated with renal involvement in SLE, particularly lupus nephritis. Hyperthyroidism, diet, and alcohol consumption do not have a direct impact on renal involvement in SLE. 103. What is the primary mechanism of tissue injury in systemic lupus erythematosus, SLE? A. Direct viral invasion. B. Autoantibody-mediated immune complex deposition. C. Bacterial infection. D. Mechanical trauma. Answer: autoantibody-mediated immune complex deposition. Rationale: the primary mechanism of tissue injury in SLE is the formation of immune complexes that deposit in various tissues, leading to inflammation and damage. Direct viral invasion, bacterial infection, and mechanical trauma are not the primary mechanisms in SLE. 104. Which of the following is an important consideration when prescribing corticosteroids for a patient with systemic lupus erythematosus, SLE? A. Risk of osteoporosis. B. Increased risk of anemia. C. Decreased blood pressure. D. Increased risk of infection. Answer: risk of osteoporosis. Rationale: Corticosteroids increase the risk of osteoporosis, especially with long-term use, due to their effect on calcium metabolism. Anemia, decreased blood pressure, and increased risk of infection are not as prominent concerns with corticosteroid therapy in SLE. 105. A 25-year-old woman with systemic lupus erythematosus, SLE, asks about pregnancy. What is the most important consideration before conception? A. Discontinuation of hydroxychloroquine. B. Discontinuation of corticosteroids. C. Control of disease activity. D. Avoidance of folic acid supplementation. Answer: control of disease activity. Rationale: before conception, it is critical to ensure that the SLE is well controlled, as active disease can increase the risk of complications during pregnancy. Hydroxychloroquine and corticosteroids may be continued if necessary, and folic acid should be taken to prevent neural tube defects. 106. What is the first-line treatment for lupus nephritis in systemic lupus erythematosus, SLE? A. Cyclophosphamide. B. Mycophenolate mofetil. C. Hydroxychloroquine. D. Rituximab. Answer: mycophenolate mofetil. Rationale: mycophenolate mofetil is often used as the first-line treatment for lupus nephritis, particularly in patients with moderate to severe disease. Cyclophosphamide is reserved for more severe cases, while hydroxychloroquine is not used for lupus nephritis treatment. 107. Which of the following should be avoided in patients with systemic lupus erythematosus, SLE, due to an increased risk of flare-ups? A. High-dose corticosteroids. B. Low-dose aspirin. C. Antihistamines. D. Anticonvulsants. Answer: high-dose corticosteroids. Rationale: high-dose corticosteroids are associated with increased flare-ups of SLE and should be avoided when possible. Low-dose aspirin, antihistamines, and anticonvulsants are not directly associated with flare-ups of SLE. 108. What is the most common pulmonary complication in systemic lupus erythematosus, SLE? A. Pulmonary embolism. B. Pneumonia. C. Lupus pleuritis. D. Acute respiratory distress syndrome, ARDS. Answer: lupus pleuritis. Rationale: lupus pleuritis, inflammation of the pleura due to SLE, is the most common pulmonary complication. Pulmonary embolism, pneumonia, and ARDS are less commonly associated with SLE. 109. Which of the following is the most appropriate pharmacologic treatment for a patient with systemic lupus erythematosus, SLE, experiencing an acute flare? A. Prednisone. B. Methotrexate. C. Hydroxychloroquine. D. Rituximab. Answer: prednisone. Rationale: prednisone, a corticosteroid, is the most appropriate treatment for an acute flare of SLE to quickly reduce inflammation. Methotrexate and hydroxychloroquine are used for maintenance therapy, while rituximab is reserved for refractory cases. 110. Which of the following laboratory findings is typically seen in systemic lupus erythematosus, SLE? A. Elevated creatine kinase, CK. B. Low hemoglobin levels. C. Positive anti-citrullonated peptide antibodies, ACPA. D. Elevated thyroid-stimulating hormone, TSH. Answer: low hemoglobin levels. Rationale: low hemoglobin levels, due to anemia, are commonly seen in SLE. Elevated CK is not typical in SLE, and ACPA is more specific for rheumatoid arthritis. Elevated TSH would indicate thyroid dysfunction, not SLE. 111. Which of the following is a common dermatologic manifestation of systemic lupus erythematosus, SLE? A. Psoriasis. B. Malar rash. C. Erythema multiforme. D. Seborrheic dermatitis. Answer: malar rash. Rationale: the characteristic malar butterfly-shaped rash is a hallmark dermatologic feature of SLE, occurring in most patients. Psoriasis and erythema multiforme are not common in SLE, and seborrheic dermatitis does not have this distinctive pattern. 112. Which laboratory test is commonly used to screen for systemic lupus erythematosus, SLE? A. Complete blood count, CBC. B. Antinuclear antibody, ANA. C. Liver function tests, LFTs. D. Brain natriuretic peptide, BNP. Answer: antinuclear antibody, ANA. Rationale: the ANA test is a sensitive screening tool for SLE, though it is not specific. A positive ANA result can suggest autoimmune diseases like SLE, while CBC and LFTs are not diagnostic of SLE, and BNP is used to evaluate heart failure. 113. In a patient with systemic lupus erythematosus, SLE, which of the following is most commonly associated with renal involvement? A. Hematuria. B. Jaundice. C. Hypoglycemia. D. Painless swelling in the legs. Answer: hematuria. Rationale: hematuria is a common sign of lupus nephritis, which is a frequent complication of SLE. Jaundice, hypoglycemia, and painless swelling in the legs are not commonly seen in lupus nephritis. 114. Which of the following is a common neurological manifestation in systemic lupus erythematosus, SLE? A. Seizures. B. Insomnia. C. Tinnitus. D. Vertigo. Answer: seizures. Rationale: seizures are a common neurological manifestation in SLE due to central nervous system (CNS) involvement. Insomnia, tinnitus, and vertigo may occur but are not as directly associated with SLE as seizures are. 115. Which of the following medications is commonly used to treat severe or refractory cases of systemic lupus erythematosus, SLE? A. Hydroxychloroquine. B. Methotrexate. C. Cyclophosphamide. D. Prednisone. Answer: cyclophosphamide. Rationale: cyclophosphamide is commonly used for severe or refractory cases of SLE, especially when there is significant organ involvement. Hydroxychloroquine and methotrexate are used for milder disease, and prednisone is used for acute flares. 116. Which of the following non-pharmacological interventions is most important in managing systemic lupus erythematosus, SLE? A. Avoidance of sunlight. B. Low-fat diet. C. Regular exercise. D. Smoking cessation. Answer: avoidance of sunlight. Rationale: sunlight exposure can trigger lupus flares, so patients with SLE should avoid direct sunlight and use sunscreen. While diet, exercise, and smoking cessation are important for overall health, sunlight protection is more specific for managing SLE. 117. Which of the following laboratory findings is most likely to indicate active systemic lupus erythematosus, SLE? A. Elevated white blood cell count. B. Low platelet count. C. Increased anti-dsDNA antibody levels. D. Normal C-reactive protein, CRP. Answer: increased anti-dsDNA antibody levels. Rationale: increased levels of anti-dsDNA antibodies are associated with active SLE, especially in cases of lupus nephritis. Elevated white blood cell count and low platelet count are nonspecific, and CRP is typically normal in SLE flares. 118. Which of the following is the most common cardiovascular complication of systemic lupus erythematosus, SLE? A. Myocardial infarction. B. Endocarditis. C. Stroke. D. Pericarditis. Answer: pericarditis. Rationale: pericarditis is the most common cardiovascular complication of SLE, occurring due to inflammation of the pericardium. Myocardial infarction, endocarditis, and stroke are less commonly associated with SLE. 119. Which of the following lifestyle modifications is most important for a patient with systemic lupus erythematosus, SLE? A. Limiting alcohol intake. B. Weight loss. C. Regular exercise. D. Stress management. Answer: stress management. Rationale: stress can trigger flares in patients with SLE, so stress management techniques are essential. While alcohol intake, weight loss, and exercise are important for overall health, stress management is more directly related to preventing disease flare-ups. 120. A patient with systemic lupus erythematosus, SLE, presents with joint pain and stiffness. What is the most likely diagnosis? A. Rheumatoid arthritis. B. Osteoarthritis. C. Lupus arthritis. D. Gout. Answer: lupus arthritis. Rationale: lupus arthritis is a common manifestation of SLE, typically presenting with joint pain and stiffness. Rheumatoid arthritis and osteoarthritis are different diseases, and gout typically presents with pain in the big toe. 121. Which of the following is the most common cause of death in patients with systemic lupus erythematosus, SLE? A. Infection. B. Renal failure. C. Cardiovascular disease. D. Stroke. Answer: infection. Rationale: infection is the leading cause of death in patients with SLE due to the immunosuppressive effects of the disease and its treatment. Renal failure, cardiovascular disease, and stroke are important causes of morbidity, but less common causes of death. 122. Which of the following is the most important vaccination for a patient with systemic lupus erythematosus, SLE? A. Influenza vaccine. B. MMR vaccine. C. Hepatitis B vaccine. D. Varicella vaccine. Answer: influenza vaccine. Rationale: the influenza vaccine is particularly important for patients with SLE because they are at higher risk for complications from influenza. MMR, hepatitis B, and varicella vaccines are also important, but influenza vaccine is most urgent for immune-compromised patients. 123. What is the role of hydroxychloroquine in the management of systemic lupus erythematosus, SLE? A. It reduces inflammation. B. It prevents disease flares. C. It treats renal involvement. D. It improves joint function. Answer: it prevents disease flares. Rationale: hydroxychloroquine is used primarily to prevent disease flares and reduce disease activity in SLE. It is not effective for treating renal involvement, although it may help with joint function and inflammation in some patients. 124. What is the most significant risk factor for developing systemic lupus erythematosus, SLE? A. Family history of autoimmune disease. B. Male gender. C. Advanced age. D. Smoking. Answer: family history of autoimmune disease. Rationale: a family history of autoimmune diseases is the most significant risk factor for developing SLE. Gender, age, and smoking are not as strong risk factors compared to genetic predisposition. 125. In patients with systemic lupus erythematosus, SLE, which of the following is a potential complication of corticosteroid therapy? A. Osteoporosis. B. Hyperkalemia. C. Acute renal failure. D. Liver damage. Answer: osteoporosis. Rationale: long-term corticosteroid use in SLE patients increases the risk of osteoporosis due to reduced calcium absorption. Hyperkalemia, acute renal failure, and liver damage are not typical side effects of corticosteroid therapy in SLE. 126. What is the most effective way to prevent flares in systemic lupus erythematosus, SLE? A. Sun protection. B. Avoidance of high-protein diet. C. Limited physical activity. D. Antioxidant supplementation. Answer: sun protection. Rationale: sun protection is the most effective way to prevent flares in SLE, as ultraviolet light can trigger disease activity. The other options are not as directly associated with preventing flares. 127. Which of the following is the most common hematologic abnormality seen in systemic lupus erythematosus, SLE? A. Leukopenia. B. Eosinophilia. C. Thrombocytosis. D. Anemia. Answer: anemia. Rationale: anemia is the most common hematologic abnormality seen in SLE patients due to chronic inflammation and other disease-related factors. Leukopenia and thrombocytopenia may also occur but are less common. Eosinophilia is rare in SLE. 128. In a patient with systemic lupus erythematosus, SLE, what is the recommended first-line treatment for mild disease? A. Methotrexate. B. Hydroxychloroquine. C. Cyclophosphamide. D. Azathioprine. Answer: hydroxychloroquine. Rationale: hydroxychloroquine is the first-line treatment for mild SLE due to its ability to reduce disease activity and prevent flares. Methotrexate and cyclophosphamide are used for more severe cases. Azathioprine is another option for immunosuppressive therapy. 129. Which of the following is the most likely cause of thrombocytopenia in a patient with systemic lupus erythematosus, SLE? A. Autoimmune destruction of platelets. B. Chemotherapy. C. Iron deficiency. D. Vitamin B12 deficiency. Answer: autoimmune destruction of platelets. Rationale: thrombocytopenia in SLE is often due to autoimmune destruction of platelets. Chemotherapy and nutrient deficiencies are not common causes in this scenario. 130. What is the first-line treatment for acute flares of systemic lupus erythematosus, SLE? A. Methotrexate. B. Cyclophosphamide. C. Corticosteroids. D. Azathioprine. Answer: corticosteroids. Rationale: corticosteroids are used as the first-line treatment for acute SLE flares to rapidly reduce inflammation and manage symptoms. Methotrexate and cyclophosphamide are used for more severe or chronic cases, while azathioprine is an alternative immunosuppressive agent. 131. In systemic lupus erythematosus, SLE, which of the following is a common ocular manifestation? A. Uveitis. B. Conjunctivitis. C. Retinal detachment. D. Glaucoma. Answer: uveitis. Rationale: uveitis is a common ocular manifestation in SLE, particularly anterior uveitis. Conjunctivitis, retinal detachment, and glaucoma are less commonly associated with SLE. 132. Which of the following is a major diagnostic criterion for systemic lupus erythematosus, SLE? A. Positive ANA. B. Positive rheumatoid factor, RF. C. Elevated C-reactive protein, CRP. D. Elevated white blood cell count, WBC. Answer: positive ANA. Rationale: a positive ANA test is a major diagnostic criterion for SLE, although it is not specific. The other options are not used as major diagnostic criteria for SLE. 133. Which of the following autoimmune diseases commonly overlaps with systemic lupus erythematosus, SLE? A. Rheumatoid arthritis. B. Hashimoto's thyroiditis. C. Sjogren's syndrome. D. Celiac disease. Answer: Sjogren's syndrome. Rationale: Sjogren's syndrome commonly overlaps with SLE, particularly in terms of dry eyes and mouth. Rheumatoid arthritis and Hashimoto's thyroiditis may also overlap but are less common, and celiac disease does not typically overlap with SLE. 134. What is the typical onset age range for systemic lupus erythematosus, SLE? A. 10 to 20 years. B. 20 to 40 years. C. 40 to 60 years. D. 60 to 80 years. Answer: 20 to 40 years. Rationale: SLE typically presents in young adults, with the highest incidence in women aged 20 to 40 years. The other age ranges are less typical for the onset of SLE. 135. Which of the following tests is most commonly used to monitor disease activity in systemic lupus erythematosus, SLE? A. Serum creatinine. B. C3 and C4 complement levels. C. Erythrocyte sedimentation rate, ESR. D. Liver function tests, LFTs. Answer: C3 and C4 complement levels. Rationale: the complement levels, C3 and C4, decrease during active SLE and can be used to monitor disease activity. Serum creatinine and ESR are also monitored, but they are not as specific for disease activity. LFTs are not routinely used to monitor SLE. 136. Which of the following skin conditions is frequently associated with systemic lupus erythematosus, SLE? A. Discoid lupus erythematosus. B. Psoriasis. C. Acne vulgaris. D. Eczema. Answer: discoid lupus erythematosus. Rationale: discoid lupus erythematosus is a type of chronic cutaneous lupus erythematosus that frequently occurs in SLE patients. Psoriasis, acne, and eczema are not commonly associated with SLE. 137. What is the main treatment for patients with severe lupus nephritis? A. Cyclophosphamide. B. Hydroxychloroquine. C. Methotrexate. D. Aspirin. Answer: cyclophosphamide. Rationale: cyclophosphamide is commonly used to treat severe lupus nephritis due to its immunosuppressive properties. Hydroxychloroquine and methotrexate are used for milder cases of SLE. Aspirin is not effective for lupus nephritis. 138. Which of the following is the most common cause of joint pain in systemic lupus erythematosus, SLE? A. Rheumatoid arthritis. B. SLE-associated arthritis. C. Osteoarthritis. D. Gout. Answer: SLE-associated arthritis. Rationale: SLE-associated arthritis is the most common cause of joint pain in patients with SLE, characterized by non-erosive inflammation. Rheumatoid arthritis and osteoarthritis are distinct conditions, and gout is uncommon in SLE patients. 139. In patients with systemic lupus erythematosus, SLE, which of the following is a common cause of thrombosis? A. Antiphospholipid syndrome. B. Deep vein thrombosis, DVT. C. Aortic aneurysm. D. Factor V Leiden mutation. Answer: antiphospholipid syndrome. Rationale: antiphospholipid syndrome, often associated with SLE, is a known cause of thrombosis, including deep vein thrombosis, DVT, and pulmonary embolism. Factor V Leiden mutation can also increase clot risk, but it is not as strongly associated with SLE. 140. In patients with systemic lupus erythematosus, SLE, what is a common manifestation of Raynaud's phenomenon? A. Blue fingers. B. Swelling of the hands. C. Muscle cramps. D. Excessive sweating. Answer: blue fingers. Rationale: Raynaud's phenomenon in SLE often causes fingers to turn blue, cyanosis, due to poor blood flow, followed by red when blood flow returns. Swelling, muscle cramps, and excessive sweating are not typical of Raynaud's phenomenon. 141. Which of the following vaccines is contraindicated in patients receiving immunosuppressive therapy for systemic lupus erythematosus, SLE? A. Influenza vaccine. B. Hepatitis B vaccine. C. Varicella vaccine. D. Tetanus vaccine. Answer: varicella vaccine. Rationale: the varicella vaccine, which is a live vaccine, is contraindicated in patients receiving immunosuppressive therapy for SLE due to the risk of severe infection. The other vaccines are generally safe and recommended. 142. In the management of systemic lupus erythematosus, SLE, which of the following is a first-line treatment for skin manifestations? A. Corticosteroids. B. Methotrexate. C. Rituximab. D. Antibiotics. Answer: corticosteroids. Rationale: corticosteroids are often the first-line treatment for the skin manifestations of SLE, such as the malar rash or discoid lesions. Methotrexate and rituximab are used in more severe cases, and antibiotics are not typically used for skin manifestations of SLE. 143. Which of the following is the most common cause of renal failure in systemic lupus erythematosus, SLE? A. Lupus nephritis. B. Diabetes mellitus. C. Hypertension. D. Acute tubular necrosis. Answer: lupus nephritis. Rationale: lupus nephritis is the most common cause of renal failure in SLE, causing inflammation and damage to the kidneys. Diabetes, hypertension, and acute tubular necrosis are not specific to SLE. 144. Which of the following conditions is an important differential diagnosis for systemic lupus erythematosus, SLE? A. Rheumatoid arthritis. B. Hypertension. C. Irritable bowel syndrome, IBS. D. Celiac disease. Answer: rheumatoid arthritis. Rationale: rheumatoid arthritis is an important differential diagnosis for SLE, as both conditions can present with joint pain and systemic inflammation. The other options do not have similar presentations to SLE. 145. Which of the following laboratory findings is highly suggestive of systemic lupus erythematosus, SLE? A. Positive rheumatoid factor. B. Positive anti-dsDNA. C. Elevated liver enzymes. D. Elevated troponin levels. Answer: positive anti-dsDNA. Rationale: positive anti-dsDNA antibodies are highly suggestive of SLE, especially in patients with lupus nephritis. Rheumatoid factor, elevated liver enzymes, and troponin are not as specific to SLE. 146. In patients with systemic lupus erythematosus, SLE, which of the following medications is commonly used to manage flares? A. Hydroxychloroquine. B. Azathioprine. C. Prednisone. D. Rituximab. Answer: prednisone. Rationale: Prednisone is commonly used to manage acute flares of SLE due to its potent anti-inflammatory effects. Hydroxychloroquine, azathioprine, and rituximab are used for chronic management but are not typically used during acute flares. 147. Which of the following is a common feature of neuropsychiatric lupus? A. Seizures. B. Cerebellar ataxia. C. Hemorrhagic stroke. D. Elevated white blood cell count. Answer: seizures. Rationale: seizures are a common feature of neuropsychiatric lupus, which can affect the central nervous system. Cerebellar ataxia, hemorrhagic stroke, and elevated white blood cell count are less commonly associated with neuropsychiatric lupus. 148. What is the primary role of hydroxychloroquine in the treatment of systemic lupus erythematosus, SLE? A. To control acute flare-ups. B. To reduce the risk of organ damage. C. To induce remission. D. To treat infections. Answer: to reduce the risk of organ damage. Rationale: hydroxychloroquine is used primarily to reduce the risk of organ damage, especially in the kidneys and skin, and to prevent disease flare-ups. It does not induce remission but helps manage long-term disease control. 149. In systemic lupus erythematosus, SLE, what is the most common cause of a positive anti-dsDNA antibody test? A. Chronic infection. B. Autoimmune disease. C. Neoplastic disorders. D. Drug-induced lupus. Answer: autoimmune disease. Rationale: the presence of anti-dsDNA antibodies is most commonly associated with autoimmune diseases like SLE. Chronic infections, neoplastic disorders, and drug-induced lupus are less likely to cause a positive test. 150. Which of the following best describes the role of corticosteroids in the treatment of systemic lupus erythematosus, SLE? A. They are used for chronic disease management. B. They are used for preventing flares. C. They are used to treat acute flares. D. They are used as a first-line treatment for skin manifestations. Answer: they are used to treat acute flares. Rationale: corticosteroids are primarily used to treat acute flares of SLE due to their ability to reduce inflammation quickly. They are not used for long-term disease management or prevention. For skin manifestations, topical corticosteroids may be used, but they are not the primary treatment. 151. Which of the following medications is contraindicated in systemic lupus erythematosus, SLE, due to the risk of exacerbating the disease? A. Nonsteroidal anti-inflammatory drugs, NSAIDs. B. Methotrexate. C. Hydroxychloroquine. D. Azathioprine. Answer: methotrexate. Rationale: methotrexate is contraindicated in some SLE patients due to the potential risk of worsening the disease, particularly in those with lupus nephritis or a history of liver involvement. NSAIDs, hydroxychloroquine, and azathioprine are typically used in SLE treatment. 152. Which of the following is a known risk factor for the development of systemic lupus erythematosus, SLE? A. Female gender. B. Smoking. C. Diabetes mellitus. D. Old age. Answer: female gender. Rationale: SLE is more common in females, particularly those of childbearing age. Smoking and diabetes may exacerbate SLE, but they are not primary risk factors. Old age is less commonly associated with the development of SLE. 153. Which of the following would be an important step in the management of an SLE patient presenting with nephritis? A. High-dose corticosteroids. B. Antibiotic therapy. C. Antiplatelet therapy. D. Immunosuppressive therapy. Answer: immunosuppressive therapy. Rationale: immunosuppressive therapy, such as cyclophosphamide or mycophenolate, is commonly used in the treatment of lupus nephritis. High-dose corticosteroids may also be used in combination, but antibiotics and antiplatelet therapy are not typically indicated. 154. Which of the following tests is used to evaluate lupus nephritis in patients with systemic lupus erythematosus, SLE? A. Urinary protein to creatinine ratio. B. C-reactive protein, CRP. C. B-type natriuretic peptide, BNP. D. Alanine aminotransferase, ALT. Answer: urinary protein to creatinine ratio. Rationale: The urinary protein-to-creatinine ratio is used to assess proteinuria, which is a key marker of kidney involvement in lupus nephritis. CRP, BNP, and ALT are not specific for lupus nephritis. 155. In systemic lupus erythematosus, SLE, which of the following laboratory findings is indicative of active disease? A. Low white blood cell count, WBC. B. Low C3 and C4 complement levels. C. Elevated liver enzymes. D. Elevated hemoglobin. Answer: low C3 and C4 complement levels. Rationale: low levels of C3 and C4 complement proteins are indicative of active disease in SLE, as complement consumption occurs during disease flare-ups. A low WBC count is seen in some cases, but is not specific, and elevated liver enzymes or hemoglobin are not diagnostic of active SLE. 156. Which of the following is a characteristic feature of the rash seen in systemic lupus erythematosus, SLE? A. Scaly plaques on elbows. B. Butterfly-shaped erythema across the cheeks and nose. C. Red, raised nodules on legs. D. Vesicular lesions on the chest. Answer: butterfly-shaped erythema across the cheeks and nose. Rationale: the classic butterfly-shaped erythema is a hallmark of the malar rash seen in SLE. Scaly plaques, red nodules, and vesicular lesions are not characteristic of SLE. 157. What is the most common complication of systemic lupus erythematosus, SLE, that affects the cardiovascular system? A. Myocardial infarction. B. Endocarditis. C. Pericarditis. D. Aortic aneurysm. Answer: pericarditis. Rationale: pericarditis is the most common cardiovascular complication of SLE, affecting a significant proportion of patients. Myocardial infarction, endocarditis, and aortic aneurysm are less common in SLE patients. 158. Which of the following is a significant environmental trigger for the onset of systemic lupus erythematosus, SLE? A. Sun exposure. B. Cold weather. C. High altitudes. D. Alcohol consumption. Answer: sun exposure. Rationale: sun exposure is a significant environmental trigger for SLE flare-ups, particularly the development of skin rashes. Cold weather, high altitudes, and alcohol consumption are not known to trigger the onset of SLE. 159. In systemic lupus erythematosus, SLE, which of the following is a common hematologic abnormality? A. Iron deficiency anemia. B. Leukocytosis. C. Thrombocytopenia. D. Polycythemia. Answer: thrombocytopenia. Rationale: thrombocytopenia, or a low platelet count, is a common hematologic abnormality in SLE, often due to immune-mediated destruction. Iron deficiency anemia is also common but not as directly associated with SLE. Leukocytosis and polycythemia are not characteristic of SLE. 160. In systemic lupus erythematosus, SLE, which of the following is the most common neurologic manifestation? A. Stroke. B. Cognitive dysfunction. C. Seizures. D. Parkinsonism. Answer: cognitive dysfunction. Rationale: cognitive dysfunction, including memory impairment and lupus fog, is the most common neurologic manifestation of SLE. Seizures and stroke can occur but are less common, and Parkinsonism is not typically associated with SLE.